In this unit, we have been talking about evaluation, like how do we find if our program is of value? And although we've talked about the three main types of evaluation, formative, process, and outcome evaluation, we haven't really talked a lot about how we design our evaluation strategies and how we collect data as well. So obviously, I'm not going to go over all the different types of strategies that we can use for evaluation, but what I'm going to do is focus this conversation on ones that can help you do your project this semester, okay? So I've posted this slide in the other videos as well, but to come back to it, what I keep saying is that in health promotion, we typically use a mixed methods approach, which means that we use both qualitative and quantitative information. And again, remember, when it comes to evaluation is all about like running successful interventions and knowing whether they were successful or not. Also, so we can make decisions. So we can keep them running. Decisions is like, should it keep running? Decisions, should we scale up? Decisions from a funder's perspective is like, is this worth investing in? We need to evaluate the program so we can have this data, so then we can make the decisions or like advocate for more funds or beg for more funds, or, you know, share with others what could be successful in their particular settings. Okay, so a mixed method approach usually helps us get there. So I've shown you this slide before, but I want to get into a little bit more on the different types of study design that can help us collect the data, which will inform whether the program is of value or not. And we'll get into later about what we mean by was it of value or not. So experimental design, you're familiar with this at this point, like a randomized controlled trial. You have two groups that are ideally randomly brought into your particular sample, and then we divide them randomly into two groups. The two groups are mostly similar. One group gets the intervention, one doesn't. Not often what we see. What we might do is have a quasi-experimental design where we run the intervention in one group, and then in order to collect data, we identify a comparable group. So this group got the intervention, but this other group, they're similar to this group, but they didn't get the intervention. So let's say we run an initiative like at a Sikh temple in Surrey, and there's only certain people that come into, that decide to sign up for the program, the culturally appropriate program that we have designed, ideally with their influence. And there are certain people that sign up. They go through the program, we see if there's a change in them, and then maybe we compare them to the people that didn't sign up for the program. Natural experiments, these are things that like we didn't create the thing. So like COVID, we didn't create the thing, depending on who you talk to, but we didn't create COVID. COVID developed, and there was a response to that, and there was particular outcomes associated with that. Can we compare the outcomes associated with that to that naturally occurring event to some sort of comparison population? So maybe a population that didn't have as much COVID exposure than others. Okay, and then non-experimental design, this is how a lot of health promotion initiatives are run. There's no random assignment, there's no random sampling. You can establish cause and effect, but you are gathering quantitative data this way. So surveys fit into non-experimental design, okay, as a strategy you can use during non-experimental design. Qualitative design, this book, Health Promotion Planning, Implementation, Evaluation, it focuses on three different types of qualitative design, which is phenomenological. I have a hard time saying that study, as in we collect data. And we think of data, we often think of numbers, but we collect like evidence, we collect, stories, narratives around the lived experience of individuals with respect to a particular phenomenon. So for instance, like if I run a focus group or if I run a interview, what were these people's experiences with this particular thing? Whereas a case study, we might like follow one or two people forward through time or through a particular experience, and we have them as like our showcase of the experience of, one or two people with respect to this particular intervention. And ethnographic, this is kind of harder to do, but it's more about about like the cultural group and their ways of describing and interpreting what exactly went on in your experiment. But often when we're collecting this qualitative data, a lot of the data we collect, and I have this slide here, a lot of the qualitative data we collect, these are like through interviews, case studies like I talked about as well, focus groups, artifacts, like what did people write about certain things? What did they draw about certain things? That's more on the qualitative side of things. Whereas quantitative methods, that of course our surveys fit into that. If you have logs, you can do simulation models as well. I doubt you're going to do that. For your project, you're probably going to do some sort of logs and survey data to help figure out what actually occurred. Although you might have to, when you're creating your plan as far as outcome evaluation, like distal outcome evaluation goes, you might think about using like registries or records or like community health data in order to inform some of the long-term effects of your particular intervention. Okay. Something else to think about when you are designing your particular intervention and the data you're going to collect is who is going to be in your sample of who you collect data from. Are you going to collect data from the entire population that you ran the intervention with, or are you going to just sample some of those people? Okay. For qualitative inquiry, random sampling is rarely possible. So it's rarely, like it's hard. Like for instance, let's say I want to do an interview. You know, I could put the 1,000 people's names that are part of the intervention in a computer that generates one name, and I can contact that name and they don't want to be part of it, or they just never contact me. So you sometimes have to work with like the people you have access to. Okay, so random sampling is rarely possible for often quantitative and qualitative assessment. We often use a convenient sample, right? So who like makes the most sense to ask, to survey or to ask, and even if you survey, you're not going to get everyone who's going to respond as well. One of the strategies we often use in qualitative research and health promotion is purposive sampling, as in like, who do we need to sample that is going to help us collect the correct data, the best data, right? And one of the things we use within that framework is snowball sampling. So let's say I want to survey my class. I might like have a keen student that I know is keen to help me with this particular interview, and I ask them to do it, and I'll be like, can you like ask a few friends to do it as well? So that's snowball. Participants refer other participants. And then theoretical sampling could be more like, I want people that fit these criteria. So I want men between this age and who have this particular quality, and I'm going to seek out people within my population that have that and sample them. So one thing I've been alluding to in previous videos is this concept of standards of acceptability. And this is really important for formulating your evaluation questions. And standards of acceptability speak to how do we measure? Like we want to measure whether there's a change in physical activity. So what would be an acceptable change? And is the acceptable change about extent, amount, or duration? Like, are people doing it more? Are they doing it for longer? Or maybe more variety of physical activity as well? Those are questions we might want to ask. And again, what would be an acceptable number? So in this example, have at least 95% of kindergartners completed all required vaccinations, right? That's kind of the extent, the amount as well of that particular intervention. Another standard of acceptability, and this might speak a little bit more to process evaluation, is accuracy, efficiency, and effectiveness. So an example of this is like, did the instructor cover the 5 program components? Again, that might speak more to implementation research and process evaluation than outcome evaluation. But like, if I'm measuring my process, how will I know that they did it properly? Were they on point? Did they do what they said they were going to do? And how how will I know? Speed, timing, were things delivered, or did we see a change, or did it happen in the time frame that we decided was good? Useful, enlightening, this often speaks to like people's perceptions of programs. So did study participants mostly agree that the program components help them make better decisions about nutrition? Did the school principal fully implement one of the report's recommendations? Did they find that it was useful enough to implement it? Then there's questions around costs, and then there's questions, of course, around equity as well, right? I love this one, were program participants proportional to the diversity of the school? And there's ways to assess that, right? Can I look at like who participated and what the school looks like and the demographic breakdown of both of those, and do those line up? And then again, what would be acceptable and what would not, right? So it's not just about was there a change? It's like, what is an acceptable change? What would make me feel that this, or what would make my stakeholders and what would make my participants, what would make the deliverers and the facilitators, what would make us all feel like, yeah, this had a good effect? And this slide came up before, but just to reiterate it as well, is when you are coming up with your program goals, which will inform your evaluation questions, make sure that your program goals are specific, measurable, agreed upon with your people, realistic, and within a particular time frame. Like there will be a 15% reduction in unplanned pregnancies in a particular school district in 3 years. Because if you have SMART objectives, then your evaluation questions can come through that as well. But again, that's why the pre-seed proceed model talks often about thinking about evaluation right from the beginning, because you want to think about like what would be considered success in this, and what would your program participants feel like is a successful outcome.